Hi, I'm Dr. John Young, and this is Alex, my nurse practitioner. We're here at Foundational Health Center here in Largo, Florida, and we're going to talk today about a lot of different things that may be a little bit controversial.
Right, and let me start with the questions, because what I really want to know is this: what is the deal with cholesterol? Like, patients ask me all the time, I need to lower my cholesterol. My doctor said I need to lower my cholesterol. Do I need to be on a statin drug? Is there another way?
So, one of the books that's made a huge difference in my life is this book called Malignant Medical Myths by Dr. Kaufman, who was taught at MIT. And he looked at the drug companies' own studies, not another university studies, but their own studies. And he looked specifically at this cholesterol. Boy, you got to get that cholesterol down or you're going to have heart attacks. So he used the company's own studies. And basically, here's what it said. You market a drug on relative risk reduction. That sounds really good. There's a 50% reduction in heart attack if you take our statin drug. But you take a drug on absolute. So you want to look on absolute risk reduction. So the absolute risk reduction for the statin drugs, basically they're all the same, is 0.3%.
That's nothing.
So in other words, doc, by taking this drug, there's a 0.3% chance that it's going to reduce a heart attack.
Right.
I wouldn't take that to Vegas.
No.
The other number to look at is NNT, number needed to treat. How many patients do I need to treat with this one
drug.
Statin drug to prevent a heart attack?
Right.
It's about 330 patients.
It's not worth it.
I don't feel that lucky.
No, not really.
So there's just a lot of myths of medicine that people get involved in, doctors get involved in because it's the guidelines. And maybe we have a weird practice because our patients do not fit into the guidelines. They're very unique.
Yes.
And so...
But we always get the question, right? That we need to lower the LDL cholesterol, and patients do want to lower the LDL cholesterol. What do we do about that?
Okay, very good question.
Yeah.
So Paul Dudley White, back in the 20s and 30s, the father of American cardiology, professor there at Harvard, did this study looking at cholesterol. And here's what he found out in this study. He said, when we took patients and we put them on thyroid medication.
Okay.
It's about 6 milligrams, very small dose.
Yeah.
They all had high cholesterol.
Okay.
And we noticed that after they were on them for a couple months, their cholesterol went way down. And so we stopped the study.
Okay.
Because when we took them off, the cholesterol went back up. And so a very well-known doctor in endocrinology, a Dr. A.P.R.N, went and said to Paul, so why didn't you say that thyroid was helpful? Well, I really don't think it's thyroid. I think there's something in the environment.
Okay.
And Dr. A.P.R.N went crazy because he said, you got the results, but you don't think your own test worked.
Yeah.
So that was one of the first big studies saying that when you took thyroid medication, it dropped cholesterol. So if you go back and look at the textbooks, you find out that when the thyroid production is low, you make a substance called mucin, M-U-C-I-N. And it's a jelly-like material that maybe a lot of people know about it, but you've seen people with very edematous legs.
Yes.
And you press on the leg and your fingers don't go in, but it's just hard.
Yeah.
That usually means there's a lot of mucin. It's a very hard substance. And what it does, it sits in the arteries and the cholesterol sits on the mucin.
And that's what's causing coronary artery disease, and now you have a blockage, and they're saying it's a cholesterol problem.
And Barnes and others, and we say the same thing.
Okay.
It's not that, it's the supporting mechanism, which is the mucin.
Mucin.
And then I know that you're looking at some of the things that Barnes looked at heart attacks.
Yes.
If you want to throw out some of that.
So is this why you can have, like, yeah, we're going to talk about that, but is this why, because I used to work in a cath lab, I would see patients on cholesterol medications, low cholesterol, and they would be coming to my cath lab 3 o'clock in the morning still having a heart attack. Is that why? Because we lowered their cholesterol, but they still had a heart attack.
Because they didn't deal with the mucin.
With the okay.
And that is the key.
So if you can improve people's thyroid numbers, you're saying that you can avoid heart disease.
I think it's right.
Mm-hmm.
And then I looked at the studies, and you've looked at the studies, and it's really hard to argue with the data.
Yeah.
Because I think with a lot of things, we don't get to the root. We don't get to the very bottom of what is causing the problem.
Yes, yes. And so I read in my textbooks from school when I was in school that triglycerides, elevated triglycerides, and elevate LDL. It's a symptom number one of low thyroid. But when I test my patients, everybody's normal because they say between 2.3 to 4.2 as a T3 level, they're normal. So most people are normal. Or are they?
What is normal? Why be normal?
Yeah, why be normal?
So
the blood test says it's normal.
If you go back to the physiology textbooks, which all medical students, nursing students read, it says this: the TSH, the T4, the free T4, the T3, all of that, all of those are in the blood stream.
Okay, yes.
It doesn't tell us how much is in the actual cell.
Okay.
And that's where the thyroid works. It's in the cell.
In the cell. How are you going to know if your patient have low thyroid other than doing a blood test?
Okay, so I still do the blood test, but it really doesn't really matter to me. The thyroid, besides taking amino acids and making long chain proteins and making about 3,000 enzymes in the cell, it makes the mitochondria, the battery pack or the engine in the cell, run properly.
Okay.
The engine can run too fast or too slow.
Okay.
The way you test it, and they've been doing it close to 100 years now, is you do a basal body temperature. And that's where you wake up in the morning, you do not go to the bathroom, you do not sit up, you do not do anything. You reach over to the bedside table, put the thermometer under your tongue, close your lips, digital, and wait about 2 or 3 minutes, and that temperature is what you put down. I usually have my patients do 5 of them. They don't have to be 5 days in a row. If you miss a day, who cares? But the temperature I'm looking for, that the engine runs, the best temperature for the engine in the body to run at, or the mitochondria, is 97.8 to about 98.2.
Okay.
If it's higher, then you've got a hyper fast functioning thyroid. If it's low, which 90% of our patients are low, the thyroid is not functioning properly. It's not getting into the cell.
So basically, we are treating a lot of patients with cholesterol medications, with blood pressure medications. At the end of the day, you're telling me that they have a low thyroid function inside of the cell?
Yes. We're treating the wrong thing. And if you go back and look at the older literature, everybody's reading the latest, and they forget the old guys of medicine. And the study after study has shown that you should be looking at the thyroid, and you're going to test that through the basal body temperature. And I will tell you, the things that I've seen with patients are off their blood pressure medicines.
Yes.
Their cholesterol's lower, their headaches are gone, their asthma's better.
Right.
Because any connective tissue the thyroid deals with, and that's all your blood vessels, that's all the connective tissue in the sex organs and the hollow organs, throughout the brain, and it just encompasses everything.
So there's really, so you have the blood test that you can do the basal body temperature. So that indicates, because even on a thyroid medication, let's say I put my patient on a thyroid medication, and I look at the numbers, and the numbers kind of make sense to me. They look okay, but they can sometimes come back to me and say, yeah, but I'm not 100% okay. I'm still feel like I'm sluggish, I'm still gaining weight, I'm still tired. So that's when I would probably add that basal body temperature.
And so that's what I do is I will put them on a dose for 30 days, check the basal body temperature for 5 days, and then I will make my adjustments there.
Okay.
I even saw today a person with chronic infections. First thing you think of is maybe the thyroid's not working right.
Yes.
So there's so many things that we don't realize that the thyroid is involved in. It's not called the chief gland for nothing.
Right. It's a very important organ. And you would think that a lot of doctors would be testing beyond the TSH, because that's the question I get all the time from my patients. But why are they only testing the TSH? And my TSH has always been within normal range. So I was always told that I don't have a thyroid problem. So if I have a patient like that with a low basal temperature, so I can probably adjust their thyroid.
Well, I think that as we look at our practice here,
Yeah.
which is crazy,
Right.
is this: why do the endocrinologists give us the most patients?
Yeah.
And it's not on purpose, because patients get so upset when the doctor is saying you're fine.
Right.
The blood work is fine, but I feel terrible.
Right.
And they end up here.
And we always find this, like Dr. Young says, we go back to the old literature. A lot of times we make a combination of the new and the old, and we try to make it work to the cellular level. This is what the difference is. This is what we do here. If we have to do a basal temperature test, that's what we're going to do. But we're really not too caught up on just the cholesterol. That's all we're going to do. We're just going to lower your cholesterol and things are going to be great. We don't do that.
Because we try to get to the root of the problem, and most doctors just, if you're going by the guidelines, you're not going to get to the root of the problem.
Right. And that's how we do it.
I hope we haven't caused too much controversy, but start reading your medical school physiology textbooks, and I think you'll be surprised that the thyroid really makes a huge difference in coronary artery disease.